markets. Focusing on three core areas critical to the business operations of our industry: brand protection, supply chain and manufacturing, and trade, AAFA provides members with the expertise across these disciplines to help our members navigate the complex global marketplace. With unparalleled access to personalized casework, thought leadership, and unique resources and tools, AAFA is united through its mission: advocacy that fits. AAFA continues to update resources and materials around COVID-19 relief. We have issued guidelines to support companies manufacturing PPE and have developed new resources which can be accessed from AAFA's website in its COVID-19 Resource Center. A quick technical note as we get started: we encourage everyone to participate and ask questions throughout the presentation. Please type them into the question box in your GoToWebinar control panel. They will be answered during the Q&A segment of the presentation. We are also recording today's webinar, and it will be available for download on AAFA's Learning Center, along with the presentation deck within 48 hours. If you experience any technical difficulties throughout, contact GoToWebinar support at 1-800-263-6317. Presenting today from SGS, we have Matthew McGarity, who is Senior Technical Manager, Hardlines. Matt joined SGS in 2010. He specializes in regulatory, industry requirements, and quality testing. Matt's focus is on medical PPE, environmental exposure, accelerated aging. Matt is a member of standard development organizations such as ASTM, which publish and maintain medical device methods and specifications. The three key learning objectives that we will cover today include updates on medical PPE, details of the new ASTM specification for barrier face coverings, and specification test methods and procedures. And with that, Matthew, let's begin.
Thank you so much for the introduction. I hope everyone's well today, and also happy St. Patrick's Day. I did not know it was St. Patrick's Day until someone told me, and I am Irish. It's been a long year. So yes, we're going to talk about PPE, especially medical PPE, because that's still the hot topic a year into the pandemic. Just give you a general overview and refresher on gloves, gowns, and then also the various types of facial coverings that are applicable these days, and then run you through the new ASTM F3502, which is the specification recently released by ASTM for barrier face coverings. So that's a specification that's been in the works for quite some time, and it's something that we sorely needed. So it's important that everyone is aware of what's included in that. So just as a reminder that the FDA regulates medical PPE. So they're the main regulatory body. So because it has a medical purpose. So anything that's intended for the use in diagnosing or curing, mitigating, treating, or preventing a disease really falls under the purview of the FDA. And they generally will classify medical PPE into generally the class 1 and class 2 of the 3-class system that they have for medical devices. But it is important to note that the FDA may not be the only regulator, depending on the exact use of the medical PPE item, or its intended hazard mitigation, intended user environment. So, just for an example, an N95, which we'll get into, a surgical N95, which is a medical respirator, is regulated by the FDA, but also by NIOSH because it's a respirator. So that's something to keep in mind. And also, I always say it's important to ensure to look at the product that, you may not be trying to make a medical device, say for making gloves, but by the, pictorials or the visual claims you put on that might get classified by someone or conveyed as a medical device to somebody. And just a note, so I'm going to run through the typical the methods and the specifications and the regulations that are applicable. Note there's been and there still is EUAs in effect, so there's interim policies. I always suggest going to the FDA's website because they are updated quite frequently. Well, I mean, earlier on, they were updated quite frequently, almost every other day. There'd be a new EUA or enforcement policy, but also included on that website is a nice, overview for, FAQ for importing medical devices during COVID. With different email boxes that one could email a question to, asking about a specific issue they're having. They even have an email box for if there's an issue at customs. So again, they're trying to, we're still seeing shortages, so they're still trying to work with manufacturers to really grease the skids to get the much needed medical PPE into the US. So I just want to touch on gloves real quick. Really, there's two main types of gloves, and we have examination gloves and surgical gloves, and it really depends on their intended use. So an examination glove would just be used during your normal procedures, examinations, for a physical perhaps. But a surgical glove, as you would expect by the name, is involved with actual surgery. So in possibly doing a wound surgery, anything that's going to be more in a surgical setting, that's going to be sewing up or doing a certain procedure that involves surgery. So those are the two main types. Really, and again, they do have certain requirements depending on exactly what the type of material it is and its intended use. So the FDA has certain consensus standards that they recognize depending on the application, whether it's a surgical glove or examination glove. Also the the material type. So for instance, you'll see ASTM D6319 is for nitrile gloves, for nitrile examination gloves. And a good standard to check out if you're not sure is ASTM D7103, and that's just a general medical gloves standard, and that'll help direct you to other standards that may be applicable depending on your type of product. Now, these generally include the same suite of tests or same type of test with general varying requirements depending on the use characteristics of the material. Now, there'll be palm thickness, sizing, dimensions, freedom of holes, tensile strength, before and after aging, and also labeling. One thing to be cognizant of is there is requirements for specialty gloves. So, for instance, if you have chemotherapy gloves, there is a specification that from ASTM that just deals with the validation that it is intended and can be intended gloves for chemotherapy use. That's also a requirement for the FDA. So be cognizant that you look at the material, the intended use, and if there's any special claims. You could have an examination glove, but also be a chemotherapy glove. So be cognizant and be aware of all the claims that you're making, because you may have additional requirements that have to be met. So medical gowns. So a medical gown is just a protective garment intended to be worn by healthcare workers, visitors, or what have you. Now, there's two different types. There's surgical gowns and there's non-surgical gowns. And that's the terminology I would suggest using, because there is, some people use the terms isolation gown almost to be used in place of a non-surgical gown, but you can have a surgical isolation gown. So the big difference and the main sticking point is whether it's intended to be used for surgery or it's not. So, there's many different types of FDA codes for gowns, it's 3 or 4, and they really break down until, is it intended for surgery or is it intended just for a patient to wear it, or a healthcare provider just, walking around, maybe doing a procedure, but not in-depth surgery. So, the critical, and no pun intended, the critical difference between the two, again, is the use. And because of that, there are different requirements. So generally with a surgical gown, you're going to have a higher risk level. And so, it's because it's going to be used in an operating room. And that's going to protect against, microorganisms, bodily fluids, particulate matter. And the FDA outlines the critical areas that they want to see the barrier performance testing that we're going to get into in a second. So these are the critical areas that need to be met. The areas need to pass the barrier performance testing that is specified by the FDA. And you can see that it's the cuffs and the chest and apron, so to speak. And isolation, a non-surgical gown is lower risk level, and it's just for general applications if you want to have a barrier between the environment and the wearer. And you may be wondering why, you would think that a critical area of a gown would be of a surgical gown would be larger, but this is factoring in use. If I'm a surgeon, I'm standing over the patient, and I'm going to be mainly using my hands, and I'm going to get, possibly some fluid on my chest. I'm not going to be walking around looking at patients, doing my, I'm not a nurse doing my rounds. That's why the non-surgical gown, which is, is more designed for those applications where, you're going to be doing a lot more movement. The risk level is lower because you're just visiting patients. You're not in an operating room. So the overall critical area is larger, but the requirements of the barrier performance for that critical area is lower than what is needed for a surgical gown. So the 4 levels for medical gowns, and these are specified by the AAMI PB70, and now in tandem with the FDA. It's really just establishing the risk level. And that's a question I still get a lot today is what is my gown? What's the risk level? And it's really intended for who is it designed for? What's the intended risk environment? And that way it will dictate what type of level it is. And generally, if it's a moderate, level 3 and high risk, the FDA generally sees that as a surgical gown. And if it's a low risk, minimal risk, level 2 and 1, they generally view that as a class 1 non-surgical gown. So it's very important to take a look at and see exactly what the levels are that you're also claiming, because that will really convey to the user perhaps that this is going to be, I'm going to use this, it's level 3 or 4. I might use it for, you may not say outright, come out and say that it's a surgical gown, but they might have the cognition that it can be used in higher risks and then use it in a surgical gown, a surgical setting. Now, so AAMI PB70 dictates the barrier performance. ASTM, there's ASTM 3352, which is for isolation gowns. I'm not loving the title of that because that's, like I said, you can have a surgical isolation gown. And then there's ASTM F2407, which is surgical gowns. They really look to fill in the gaps for durability and wearability and usability. While AAMI PB70 looks at the barrier performance, they're looking more at the physical requirements. So durability, pilling, evaporative resistance. So that type of testing. But note that some of the tests included in there do not have performance criteria. They're just providing methods that can be used to evaluate the gowns. So that's a question I get too a lot: is how come there's no criteria, there's no rating that I have to meet for some of these tests? It's because the standard doesn't have it. And the FDA doesn't dictate it for some of these tests that are included in the ASTM standards because they are deemed to be voluntary or extra testing. And just a quick overview, these are the different levels depending on the exactly, the risk area, then also the test that you'd have to run. So I do want to get into the types of disposable facial coverings because that will link us into the new ASTM standard, ASTM F3502. So just to make it easier and just more simplify it a bit, the way it breaks down is that we have medical masks and let's say filtering face piece respirators or N95s. Those are different than the other types of masks that we wear every day, just because they're intended to be PPE, personal protective equipment. We're designed and evaluated and go through the regulatory process to be PPE. And while the other masks that we wear, like I said, we wear every day, are not generally for PPE. So that's one important characteristic and attribute. And so that's why you might not hear the industry is still sort of vague on whether the masks we're wearing every day are they PPE. It's the FDA and the CDC are coming out and saying if you wear 2 masks you have better protection, but they're not by the strict definitions in the regulatory framework that we have in place, they're not intended to be protective. So that's one thing to be cognizant of. So for medical face masks, we do have generally 2 types. We have surgical medical masks and non-surgical medical masks. But the big thing with these is that they're loose fitting. So they're not intended to be a real tight fit, and that comes into play when it gets to respirators. And so they are loose fitting. Now the protection here, why are they considered to be? Why is a surgical mask considered to be PPE? It's because it's intended to protect the wearer from bodily fluids. So that mask, that doctor who's wearing that mask is not wearing it. Its intended protective purpose is not for filtration, particulate filtration efficiency, although it's tested for that. It's really its main protection is fluid resistance, and also protecting you or the patient from the doctor's, exhalation of any type of, bacteria or what have you, just to ensure that the doctor's not breathing into your wound when you're in surgery. So that's a key differentiator. That's why a surgical mask is protective. So the specification is ASTM F2100, and that really covers all the testing requirements that are included in medical masks. So it can be surgical masks, or it doesn't have to be a surgical mask, but they do contain the key test criteria for medical masks as a whole. And just to note that you might see surgical masks with ties. That's for an extra tighter fit. And procedural masks many times will just have loops, but if you do see a mask with ties, a medical mask, it's likely going to be a surgical mask. So these are the tests that are included. You have bacteria filtration efficiency, and that again, that is to ensure that the wearer is not emitting particles from talking to other doctors in the room, or they have a cough when they're working on you. That's to ensure that their particles, the respiratory emissions, are not reaching your wound. There's differential pressure, which is for about comfort. How well is this mask going to be able to be worn without having to take it off all the time? So that's. A mask is only as good as it is comfortable, because if it's it's very protective, but if it's not comfortable, no one's going to wear it. The doctors aren't going to wear it. And then it does have particle filtration efficiency. That's a test that they run on this on surgical masks. If you're in a setting, by what NIOSH and OSHA want to see, if a doctor's in a setting where respiratory protection really is needed, they'd prefer the doctor wear a surgical respirator. But a normal surgical mask, for instance, is tested for particle filtration efficiency, just because sometimes there are dust particles or from or surgical smoke that may be emitted, and that does provide a degree of protection for the doctor. And then the real protective part of it is the synthetic blood penetration, or fluid resistance. That's what it's called quite a bit, and that's tested from ASTM 1862. And that's, if a doctor's operating on somebody and they, unfortunately, if they nick a vein or an artery and they get splattered with blood, that's to ensure that it doesn't go to the other side of the mask and then touch their mouth. So we actually will test surgical masks at 3 different pressure levels with synthetic blood to show 3 different possibilities of blood spatter onto the mask. And then flame spread, because the surgical setting can be in an environment with ignition sources, flammability is tested on these types of surgical masks, unless they are exempt based on the material. So respirators. Respirators are really, or N95. So there's N95s are the colloquial term for respirator, although there's other types, which I'll get into momentarily. But so really respirators, there's 2 main types based upon, on a broader spectrum, based upon the use application. There's industrial and construction use respirators. So that's N95s. General N95s, that's not intended for a healthcare environment. Those would be surgical respirators. So there is a difference. A surgical respirator will meet all the requirements of a NIOSH respirator, of a non-surgical N95, but also meet some of the key attributes from the ASTM F2100 we just went through to ensure that it's covering the hazard levels of both the surgical setting and the particulate mitigation respiratory protection that it offers. So why are surgical masks different than, why are N95s different than surgical masks? And why do they offer the respiratory protection? It's because they provide that tight seal around the nose and mouth of the wearer. So it's, because these are really, they're intended for commercial applications, a worker would have to be fitted for these. Now that they're being used on a very broad scale, that fit may not be there because you may not have been fitted properly for one, but just always ensure that there's a tight seal around the nose and mouth, because that allows that 95% filtration of very small particles. And that's really why you call it 95, because it does filter out that 95% of very small 0.3 micron particles. And the reason why we have N, that's because there's also R and P, and those are for oil environments. So if I'm a worker, if I need PPE and I'm in a paint factory, or I am doing work where I have aerosol oil, I would need a P95 perhaps. There's also 99s. There's P99s. There's P100s. There's N100s, and that just is a even higher level of filtration ability of those very small particles. So again, it's really about that tight seal. And again, if it's a surgical respirator, it is also regulated by the FDA. NIOSH is the main regulatory body, and the NPPTL for respirators. So here's just a neat chart that just goes through all the different types of respirators, and also the guidance documents and the primary regulations. We've all become more familiar with a lot of these. KN95 from China. You'll see some of these respirators that have entered the U.S. via those emergency use authorizations to help fill that need. Generally, a respirator that, if you're going to have a respirator for protection for a worker, it would have to be NIOSH approved. But given the circumstances, there are some allowances, and you can reference the FDA website to see the latest on those, because like I said, they do change often. But this is just generally a general equivalence of each other. So they all have a protection factor. NIOSH has above 10. So that's these are specifically identified by NIOSH as being somewhat equivalent. There are some nuances to that. They don't recognize every single standard listed here. Again, that does change, so I would recommend going to the FDA website for that. So just want to get through the general barrier face coverings. This is kind of the new type of product that we're all so familiar with these days, and really that's to it's to reduce the respiratory emissions of the wearer. And the CDC has told us that we should be wearing these for a while now, and as everybody knows, that has led to thousands of different types of masks, and really there was no standardization, and that was something that has come about in other countries where they have been able to put together standards like AFNOR or CWA 17553. We had AATCC M14, which was a guidance document, which is a great guidance document because it provided manufacturers, for the first time that information that wasn't, generally known by everybody who wanted to start manufacturing masks, but that wasn't a specification. So it provided some information, some guidance, even some filtration efficiency, minimum requirements, and some methods. But it wasn't a specification, which a specification is really kind of more of a, has more meat to it, has more teeth to it, for lack of a better word, because it establishes minimum acceptable criteria. So ASTM 3502 is a standard specification for barrier face coverings, and it is for single and reusable. It is voluntary standard, and it is not material. Restricted. So you can have non-wovens, you can have textile materials. They do not want to be design restrictive for unless it's you have to cover the face and nose. We'll get into the design requirements momentarily, but they don't want to be design restrictive. They want to let the industry innovate through general R&D testing, but they'll establish those. They'll establish those minimum acceptable criteria and then let everybody do their thing to try to meet it. So the real purpose of these, the barrier face coverings, defined as, again, it's intended to reduce the expulsions of the wearer, but they do admit in the specification that it can potentially offer a degree of particulate filtration efficiency. We're seeing the industry and the regulators generally move into that direction where that everybody's really wearing a mask to protect themselves, even though that's not what they're intended for, but that's what everybody, if you ask somebody on the street, they're not wearing it for source control, they're wearing it for protection. So, we're the industry, which was not set up for this kind of pandemic based upon the different regulatory framework that we had now, is adjusting to it. And we'll see how it all shakes out with the next 6 months or so now that things have calmed down a bit. But this will have long-lasting impacts on the regulatory framework, and we'll see how that shakes out. But the ASTM 3502 is free. It is at astm.org. You can find it free there with other COVID-related specifications and standards, so I suggest checking that out. And again, it is similar to AFNOR and CWA 17553, but just different in execution. So they come out immediately and say, this is not intended to take the place or preempt any requirements or regulations for medical face masks that require FDA clearance or respiratory protective devices. They strictly mention that they're not getting involved in antimicrobial materials, finishes, or mechanisms. And also if there's any specific hazard protection. So, if there's a mask that needs to be worn because of some kind of other hazard, if there's a mask that's tested for electrical or high heat, this wouldn't take the place of that. But this specification can be used in conjunction with other regulations if allowable per the specification, because it can see if it can help evaluate whether those masks, for instance, that might be intended for another purpose, can be used as viable source control. Because that's really what this this specification is about. It's about workers. It's about getting back to work. It's about, what are the areas that are going to have masks moving forward, possibly. That could be hotels, it could be transit. So it's about, having a better mask specification for those workers or those individuals who will be wearing masks now and then for the foreseeable future, but also can be used for consumers as well. So who's not intended to use a mask that falls within the specification? They come out and say no children under 2. The mask should not be worn for children under 2, and that's what the CDC says anyway. Trouble breathing. If you have trouble breathing, this is not a mask for. They don't want. They don't want to have to. There's certain requirements that for particulate filtration efficiency, which inherently will impact the breathability of the mask or face covering. So they come out and say if there's someone for trouble breathing, this is not applicable for them. And also, and this is just a good general rule of thumb, if the user can't take the mask off themselves, if they're incapacitated in any way, shape, or form, they shouldn't be wearing a mask anyway. But they just, again, come out and say that this is not intended for them. So what's really included in this? It's the design, it's labeling, instructions, barrier performance, the reporting classification. So anything that you would need to standardize these types of barrier face coverings and masks. And to do that, they establish all the requirements, all the limits and the instructions, but they also include a conformity assessment, which that's a little bit different than what we've seen with other types of specifications, where you have to come out and say, it's a self-declaration, a conformity assessment, essentially, which we'll get into as well. But that's an important aspect of this. So the general design requirements, first and foremost, non-starter, it's got to cover the user's face to nose completely. And it has to have a harness system that can be durable enough to keep that the face covering or mask portion to and cover the user's face and nose. So and what also is allowed is replaceable filters. So you can have replaceable filters. They have to be tested together as the product would be used by the consumer or the worker. But really the main thing is that it covers the user's face and nose, and it has a tight fit that minimizes leakage. So those are the main design requirements. And also, with the harness system, they allow adjustable harnesses, straps, toggles. But for adult products, for children's products, not recommended to have adjustable straps or ties or toggles, because you don't want the child to make a larger loop than intended, and then there's unforeseen consequences. That is also aligned with AFNOR in CWA 17553, who also make the mention of not having adjustable straps and harnesses for children's masks. So what's not allowed is valves or vents, because these are for source control. A valve or a vent is usually, those have become in collective consciousness because people have been wearing N95s that are used for a commercial application that is more concerned with breathability. So if I'm a worker and I have an N95 on and I'm working with asbestos, I'm concerned about the air going in. So it has to have the proper filtration, but not so much the air going out. So that valve is a one-way valve out. So that's really would defeat the purpose if you had if you had a barrier face covering and then you put a valve on there. You would be defeating the purpose because the user's breath would just be going right out the valve. So that's why they say no vents or valves. Also, no flammable materials, no irritating or toxic materials, and no sharp points and sharp edges, which is just a good thing for any product, really. But they come out and say that here, especially because, it's going to have close contact with the skin, and, with who I'm speaking to, you don't need any reminder on that. So there is a leakage assessment which is interesting because a leakage assessment isn't done for surgical masks. It isn't done for medical masks. It's ensuring that the design has taken into account various aspects, in the design of the product to ensure that leakage is minimized. They want to ensure that the air that is within that mask is not leaking out into the environment. So, they establish and mandate that the manufacturer that is, declaring conformance to the specification for a barrier face covering, let's say they're making a textile barrier face covering, they want to ensure that that design team has done a qualitative assessment to ensure that leakage has been minimized. So, that's looking at, if you had multiple sizes, looking at anthropometric data that's available from NIOSH to ensure that your face covering has been sized. If you have a large, that you have sized that for a larger head size. You can't say, large, you can't say, large and then have it be sized to a smaller head, because that may not fit all the way and cover completely the user's nose and mouth if they have a larger head size. Also using any kind of nose bar, anything that would help contour to the user's nose is also a good idea. It's very loose. They don't have any specific format within the specification for a qualitative assessment. They just want to see, that you've done the due diligence, you've gone through the process of ensuring that you have a tighter fit, that you've minimized leakage, because that would be, that's one of the pillars of this specification, is that it fits tight to the user's face and nose. There's also a quantitative leakage test, and that's a voluntary aspect. And that is using ASTM F3407, and that's using a bivirate panel from NIOSH. So that's actually getting a user panel of different head sizes and then checking to ensure that the mask does fit the intended user's head. That's a little bit more difficult to do these days because it's, with it being a pandemic and all, gathering a panel of people and making, and also having to get them in to ensure that they have the proper sizes. Not the most efficient way these days, but that's why, you can use the qualitative test, and that is the mandatory one. The quantitative is voluntary. So here's just some examples of, the key measurements you can look at to ensure that, okay, if I have a nose bar, I want to have it where it's sized properly for a large sized head. You can see there on the bottom left, looking at the width of the bridge of the nose, looking at the height from the bridge of the nose to the chin. These are all key facial measurements that you can look to that have available data from NIOSH that says, for a large size, these are the measurements on average that we saw. So you can look to this data, which is available, and then help that size your mask to that using that data. But you got to be cognizant of these are two-dimensional measurements. You have to be cognizant of that. If you have a mask that's going to be covering and contouring over the face, it does have to be a bit bigger to fit. There's also some additional information on AATCC M14, which can take a look and provide you a little bit more guidance. So the barrier performance classification is another key area within ASTM F3502. So they establish 2 levels of performance for both submicron particle filtration efficiency as well as airflow resistance. And one, as a manufacturer of a mask or face covering, you can have 4 different classifications. You could have level 1 for submicron particle filtration efficiency, and then a level 2 for airflow resistance, or vice versa. Or it can be all level 1 or all level 2. So, 4 different types of classifications, with level 1 being the minimum. So that's really the minimum. You can't go lower than that. The one thing I want to bring up about the barrier performance is that it is different than probably the other specifications that you may have tested to. You may have tested to AFNOR or CWA, or using AATCC M14. They generally use larger particle sizes, a larger particle size distribution, closer to 3 microns. This is a submicron test, so this is much lower, a much smaller of a micron test. So with that, generally, the smaller the particles, the lower the filtration efficiency. So don't be alarmed if you do a test and then see, why does my mass suddenly have such a difference in performance all of a sudden? It's because there's key critical differences between how the methods are performed, the filtration efficiency methods are performed. So don't be alarmed. You will see a difference, and really, it's because the ASTM F3502 harnesses a submicron particulate filtration efficiency method that's based on a NIOSH method that's less than 1 micron. So be aware of that. And there's also bacterial filtration efficiency. That's optional at this point. Who knows? It could become an either or a mandatory requirement in the future, but right now it is optional. So the airflow resistance is, really the other half of the filter media. You have fit, and then you have how well it filters, and then the other half of the filter itself is the breathability. So they want to ensure that if you have, if you're performing at such a high level, you do have breathability, again, because the mask or face covering is always as good as the person is comfortable enough to wear it. So you don't want to make it too stuffy, or they won't wear it. So it really is a delicate balance between filtration efficiency and breathability. And another important note with this ASTM F3502, they don't specify a specific method like ASTM D737 or another barrier, air permeability or differential pressure method. They do the method, they measure the airflow resistance really at the same time as they're doing the particulate filtration efficiency. So it isn't a separate methodology. It is done per the specification at the same time. So the number of samples, there are 10 samples per condition. So the condition means if you have a reusable face covering, you would do testing to confirm its barrier performance initially as received, and then after the claimed number of washes or its service life. For a single use, we would just do the barrier evaluation initially as received. So 10 for a single, and then it spells out pretty clearly 10 new and then 10 after washed for a total of 20. So another part of the specification is they want to, ASTM and really the industry as a whole wants to increase consumer awareness of the classifications for these types of, they don't fit into medical masks, they don't fit into respirators. So they really this new type. So so part of this is if whatever barrier for performance that you are claiming, you have to make that a known on the package to the consumer so they could buy a mask that has whatever criteria they're looking for. If they want to, if the consumer wants to have a mask that has greater breathability because they're going to wear it at the gym, they'll be able to see that now because of this visual classification rating. So the labeling on the product, they have labeling that's on the packaging, but also on the product. So on the product itself, and they do mention a hang tag as an idea, you have to mention the manufacturer, the model and style number, and the statement that it meets ASTM F3502. And they said that the information shall be accessible without damaging the product, but also to note, this is not to preempt any requirements that need to be permanent anywhere. Whether it's the textile labeling or a children's tracking label, these are all items that have their own regulations, and so they really come first. And there are some exemptions allowed for labeling a product that's not feasible or affects the utility of the product. But just to be aware that you do have to follow the existing regulations that are applicable as first and foremost. So all the other labeling that has to be on there for the packaging, and that's, the model and style number, the materials of construction, all this information should be available at point of sale to the consumer, because they may not want to, they might be allergic to certain materials. Also, the size, if there's different sizes, the consumer is going to have to know what size. I have a large Irish head, so I need a bigger mask. So I would get, a larger mask, maybe, I'd use a medium or a large as opposed to a small. Like I said, the visual classification, and then also the use and warning statement, which is important because they do want to emphasize, we've had a lot of confusion with different types of masks, the intent, the N95s have been used for talking about 15 different types of masks that aren't N95s, and surgical masks, same thing with those. So they want to ensure that a mask that is meeting ASTM 3502 is not a it is not a ASTM 2100 medical mask. It is not a respirator. They just want to ensure that the user is aware of the limitations, that it's, the filtration level that's going to be on the product is for how it filters going out, not coming in. Again, that seems a little bit counterintuitive, but again, these are for source control. They're not for protection, and they're not intended primarily for the protection of the wearer. Although, again, they do make a comment that it does, provide some ancillary protection. So also included are instructions, and that's really how to wear, how to use, clean, dispose, everything that you would need to know, or the consumer would need to know, to use the barrier face covering as intended, as to get the most useful life out of the product, or the to just use and wear it as it's intended. So that would be, procedures for doffing and donning, sizing information. And that's important because it's also, how to choose the right size if I'm a consumer. So all this information is within the specification. They have some context added to it to give you more of an idea, but also any applicable caution and use limitation statements. As we're wearing masks in situations that we never thought we would be wearing masks, there's different caution and use limitation statements that are included within the specification. One of them, which is a bit interesting, is if you have a metal nose bar or a metal component in your mask, they recommend that you have a label on there saying don't use during MRIs. That's something that we never thought we would think about, but now here we are. And there's also caution use limitation statements about trouble breathing, if the user's incapacitated, what we went through earlier. And then also talking about the service life, which is required. And that's not any different than AFNOR, which also required service life. So instructions for donning and doffing, just taking it on, taking it off. But also an important note is if you have a replaceable filter, you need to have instructions in there to how to put that filter in without putting it in incorrectly. If the replaceable filter is possible to put in there incorrectly, so the user can conceivably do that, ASTM F3502 wants you to have a note in there saying, this is how you do it. In a weird aspect, think of it similar to batteries, where it's, this side up or what have you. Because if the filter, it doesn't work properly, if it's not seated in there, the user's not, the source control is not happening as intended. So sizing, again, have the proper size, but also if there's adjustable toggles and switches, instructions on how to use those to ensure they can get the maximum fit. But again, it's don't use those for children's masks. But really the sizing, the big takeaway is that it really fits neatly and snugly over the user's nose and mouth. So service life, this is for reusable masks and face coverings, and it is similar to the other specifications out there. And that's really the ensuring that the claim made for its barrier performance is being met initially and after the claim number of washes. And it's really just about maintaining that barrier performance, because as we all know, textile materials can be changed through washing and drying, and that's really to prove reusability. So you'd have to meet the barrier performance. So 10 before and 10 after, 20 total, as we discussed, but also ensure that, make sure your mask and face covering isn't shrinking as well. So, if there's any excessive shrinking, that's something to take a look at. But really, this is all about improving, reusability, because you're claiming that with the service life. So reusable products do need care instructions, as we know. CPSC does consider them to be wearing apparel. So they do have to have the care instructions, and this ASTM F3502 defers to CPSC, the FTC and CPSC for any other requirements that are outside the jurisdiction. So this would also be including care instructions. So following 16 CFR Part 423, and they do reference ASTM standards for care instructions and symbols and labels. So, your industry, this is, you guys know this backwards and forwards, but some other industries, let's say the non-wovens, care instructions were a bit new to them because they weren't making these types of washable products before. So the caution, use, and limitation statements, I spoke to about the metal in to be worn during the MRI. Barrier face coverings should not, like I said, should not be worn for very young children under the age of 2, or anyone who's incapacitated or trouble breathing. What they do mention that you should have on there, and these are listed in the specification. I would suggest reviewing it for see what might be applicable to your product. But if there's a barrier face covering that has a level 1 airflow resistance, so it's a little bit harder to breathe, they suggest a statement saying, that may not be suitable for children, and it may not be suitable for adults that have difficulty breathing, just to drive home again that there could be unforeseen issues. So really went through this. Children's face coverings, they're children's products first and foremost. They're not intended to, specifications not intended to preempt any requirements for children's products. Again, careful with any adjustable straps, again, because that could have unforeseen consequences. And then again, it's got to comply with all the CPSIA requirements, lead content, tracking label, CPC, and also just as a refresher, if you're not sure what your children's product, if your mask is a children's product, and it's different when you have a very gregarious, a children's product where it's very obvious, but these are masks. It could be a size small. Does that mean a children's product, or does that mean just a size small? Look at the product itself. Is it intended for a child? Do you have a statement on there? Is there cartoons or pictures that would be appealing to a child? So recommend everybody review the CPSC's children age determination guidelines. Flammability, everyone, it's got to meet the flammability requirements for the CPSC. So 16 CFR 1610. They do follow the exemptions that they're outlined based upon weight and fiber type, textile fiber type. And lastly, the conformity assessment. The conformity assessment is important because if you want to meet the specification, you have to pass everything that's involved that we just outlined, and also do a self-declaration saying that this is my product. I am the manufacturer. I have done this design, a qualitative or quantitative leakage assessment to ensure that I've minimized leakage. And importantly, I've had the barrier performance tests, the submicron particulate filtration efficiency and the airflow resistance. You have to have that done in an ISO 17025 accredited lab. That's mandatory, and you have to show the lab's credentials. So they have it all outlined in the within the conformity assessment. I believe it's section 12 of ASTM 3502. I suggest taking a look at that. Last, real quick, limitations. The specification does not get into wear duration. So, AFNOR in the beginning said you can wear the mask for a certain amount of time. I believe it was 4 hours. They don't get into wear duration within the specification. They don't really touch on specifics for restricted substances. So filing an RSL would be, your typical RSL would be advised. And they're not really getting into material degradation. So not so much material strength. So that's all testing that you would still need to do to ensure durability of the product. This is just looking at the aspects that are germane to its use as a barrier face covering. And lastly, we already spoke about AATCM 14. Still a good guidance document. It's got some really good information on there for material, textile and fiber selection. I would suggest taking a look at that. And then just SGS, we offer all this testing for gloves, masks, gowns, respirators. We're here to help if you have any questions, technical questions. Thank you for the time. And I think I only left 3 minutes for a Q&A, so hopefully I'll be able to get a couple in.
All right. Well, thank you so much, Matthew. That was a great presentation. Yes, we can take one or two of the questions now that we've received from the audience. Any other questions, folks, that we don't get to, be sure to email them to us and we'll get them to Matthew and he can respond directly to them. So one question we have right now from the audience is, do you anticipate that the ASTM F3502 will become mandatory?
It's an interesting question because it can be, we're in a time right now where emergency use authorizations or executive orders can have drastic impact essentially overnight. So I would say, barring that, it's certainly possible in the future that this would be adopted in some form as a requirement for source control masks for essential workers, perhaps. So that could happen. But in the short term, we do got to be aware that President Biden has collaborated with OSHA to possibly make a mask mandate for workers. There's one in for transit, but this would be for all workers. They set a deadline of the 15th that has passed. There's no new information about that now, but who knows? They could say that ASTM 3502 is mandatory for certain type of applications and workers have to wear it. So it's difficult to answer, but it is possible.
All right, thank you. One last question before we conclude for the day. Who determines service life?
So the service life would be determined by the manufacturer, and then it would be validated or confirmed, verified by the laboratory. So the lab won't just pick a service life to test that. It would need to know the service life that's intended. But if you don't, if you don't know what the service life is, you can do some R&D and do some interval wash and then do an interval and see where you're at, just to get a starting point.
All right. Well, thank you so much. Thanks again to our speaker, Matthew McGarity. On behalf of AAFA, we would like to thank you for joining this session and thank you to SGS for sponsoring today's program. An email with links to the PDF and recording from today's program will be sent to you. Thank you again for joining us and have a great rest of your day.